At Parkside Pediatrics in Spartanburg, South Carolina, some families are now seen outside, in the clinic's parking lot. Doctors and nurses peer inside cars and minivans, scanning young faces for signs of one of the world's most contagious diseases, measles.
They don't come in the building, they go and we see them in the car. We go out and we put all our PPE on and we have some designated spots and we do our exam there and everything outside.
Staff like Nathan Heffington are desperately trying to keep the disease out of their waiting rooms, already packed with infants and small children who are too young to be vaccinated. The South Carolina outbreak has hit more than 930 reported cases, and some medical providers fear the actual numbers are far higher. Federal health data show it's the largest U.S. measles outbreak in more than 30 years, and Spartanburg County is the epicenter. Doctors fear that outbreaks like this one are becoming the new normal. Why? Because American opposition to vaccines is deepening, and a desire for medical freedom is growing. Resistance to routine shots is fueled by a few things: backlash to the COVID-19 response, misinformation on social media, and more recently, the anti-vaccine policies of the country's health secretary, Robert F. Kennedy Jr.
First of all, anybody who wants to take a vaccine, I'm not going to get in their way, but I am going to tell the truth to Americans.
You know, asking questions, that is healthy, that is good. But when things get politicized, people get dug in and you just don't listen to reason from either side. And so I think that's what happened with COVID, and it's just created these camps that then become immovable because the person I voted for says this or the person I voted for says this.
Here in Spartanburg County, only 89% of students are up to date on their shots. Public health experts say you need 95% of the population vaccinated to stop the virus spreading. In some local schools, vaccination rates have dropped below 20%, according to state data. This matters because measles is one of the most contagious viruses in the world. Let's take a look at how it spreads. This person here is infected with a disease. In a population with no immunity, they can infect 12 to 18 others. Those 12 to 18 people can then infect another 12 to 18 people each. That's much more contagious than diseases like chickenpox or COVID-19. Dr. Lee Bragg is a pediatrician near Spartanburg and has watched immunization rates drop since the pandemic. She says local hospitals, churches, and schools are wary of speaking up about the best proven way to curb the outbreak, fearing they will offend their neighbors.
Sharps containers.
And South Carolina's Republican governor has championed personal choice.
Vaccinations, unfortunately, the past 2 years have become a very polarizing topic. It's something that people kind of shy away from, and they don't want to be, I'm the person that advocates for vaccines all the time, and these big systems don't want to come across as pro-vaccines, even though they know vaccines save lives.
The measles, mumps, and rubella shot is still recommended at the federal level, but reluctance can run deep. When Kathleen Black's youngest child was born about a year ago, she wanted to hold off on routine immunizations.
I like to go down those rabbit holes, and it opens up millions of questions, like what's in the vaccines, why are we giving all these vaccines, and when she was born, I was thinking about maybe not vaccinating her. I vaccinated my other two, but maybe I won't do her.
The mother of 3 says she heard from friends and social media that childhood vaccines may cause autism or developmental delays. These claims are not supported by medical research.
It's a very controversial thing, and I've asked you a lot of questions.
Yeah, we've talked a lot about it.
She did eventually vaccinate her child, but Heffington says many parents have lost respect for and fear of this disease. Before vaccines became widespread, back in the 1960s, measles infected millions of American children each year, killing hundreds.
One of the things I always say is talk to somebody who's over 70, talk to a grandparent, great-grandparent, and ask them what they think about vaccines. You know, they were lining up to get shots.
In previous outbreaks, the federal government would lead the vaccination charge and coordinate interstate efforts to slow the spread of disease. Last month, the Trump administration said it sent South Carolina $1.4 million to support its measles response. And state officials said the government has helped with testing, medical advice, and free vaccines. But Health Secretary Kennedy, who has promoted unproven theories about the dangers of vaccines for years, hasn't made any major statements on the South Carolina measles outbreak. And 2 former employees at the state's public health department told Reuters the outbreak here struck following reductions in federal funding and overall staffing in recent years. At the federal level, the U.S. Health Department didn't respond to a request for comment. As political leaders shy away from a strong endorsement of vaccines, it is left to medical providers like Heffington to persuade reluctant parents of their value.
These people that are coming in and choosing not to vaccinate, they're trying to do the best thing for what they think is the best for their child. And I think trying to help everybody understand, like, we're all on the same team here. I want what's best for your child. I'm not running secret government experiments. There's nothing secret about any of this. There's a lot of evidence showing this is the best thing for your child.
Yeah, okay, and that's why she's coughing.
Yeah, one more.